NeckCare has had a tremendous impact on my patient outcomes. I know what I need to work on, and then I have a very objective way to track their progress and see if my therapies are actually improving the areas that the patients need to improve on. I've seen a huge increase in patient referrals since implementing NeckCare. A comment that I hear at the end of all of my exams is that that was the most thorough, eye-opening, and educational exam that they've ever received from any practitioner that they've gone to visit, primary care physician, neurologist included. And I think that patients really appreciate being a part of their journey and seeing what is actually taking place with their bodies. And NeckCare provides that feedback to them, immediately identifies, is there a cervical issue and does it need to be addressed? And then once I notice that there is a cervical issue of some sort, I can tell, well, is it a proprioceptive issue? Is it more of a biomechanical issue, meaning they have range of motion issues? Or is it a combination of both? And then I can detail the care plan to address those specific deficits in that patient. The feedback I get most from patients is they're just surprised at what they see as the result of their test compared to what they had anticipated or perceived themselves before actually seeing the results come up on screen. So some patients might think that they did really poorly, and they actually are surprised to see that they did very well. On the other hand, I have patients that might have felt like they didn't have an issue at all and were even reluctant to do the test. And then after they see how poorly they did, are then very invested and interested in trying to correct that problem, because it really just blows them away that they could see right then and there the deficits that they have. Patients 100% have more confidence in me after implementing NeckCare. One, they see I'm trying to be as scientific as possible and address their issues at the highest level possible. And they respect that. They like that. They want to know that they're in an office that is striving to keep up with the times, to be on the cutting edge. When a patient sees that you're willing to put that effort in and get that kind of equipment, I've never had anyone say that they were disappointed or didn't appreciate that. The biggest benefit for me doing functional neurology is I always try to assess the patient's vestibular system, proprioceptive system, and their vision. And there's numerous tools out there that will assess vision or particularly a vestibular dysfunction, but there's not a lot out there that will assess proprioception. And NeckCare has given me that last component to really dive deep into a person's neurology and then tailor their care to that specific issue in proprioception and document it and provide patients with feedback on how well their care is going and the progress I see. So 100% for me, it's been a game changer for my practice. And I would go as far to say that I wouldn't practice without it. And I don't see how any other chiropractor could. If you're a chiropractor that does anything with a patient's neck, you absolutely need NeckCare so that you can track what you're doing and see if it's actually helping the patient and improving on the areas that they need improving on.